The link between obesity and periodontitis, what does the science say? So obesity and gum disease are two major global health concerns, but could there be a hidden connection between excess body fat and the health of your gums? So in this video, we will explore the scientific link between obesity and periodontitis, uncovering mechanisms behind this association and what current research has to say. Over the past few decades, obesity has reached epidemic levels with over 650 million adults classified as obese, and that's according to the World Health Organization. At the same time, periodontitis is an inflammatory disease affecting the gums and supporting structures of the teeth, and remains one of the leading causes of tooth loss worldwide. The exact mechanism linking obesity to periodontitis is still under investigation, but inflammation is at the center of it all. So obesity, it leads to a chronic low-grade inflammatory stage which disturbs the immune system and promotes tissue damage, including the gums. In obese individuals, your immune cells like Th1 helper cells, the macrophage, become overactive. So they release inflammatory molecules such as interferon alpha, tumor necrosis factor alpha, interleukin 12, which can worsen periodontal inflammation. So what is the role of fat? Fat is not just storage, it's hormonally active tissue. It means that adipose tissue, including adipocytes and macrophage, produce over 50 signaling molecules called adipokines. These include cytokines that can alter your immune system and increase your susceptibility to gum disease. So there's multiple studies have linked between obesity to increased risk and severity of periodontitis. There's one study, which is a long-term study, found that just a 1% increase in waist to height ratio was associated with a 3% increase in periodontitis progression over 27 years. Another review showed that obese individuals responded poorly to non-surgical periodontal treatment. In fact, for every 10 kilograms, there's an increase in BMI. The number of deep gum pockets increased by 2.5%. However, there are limitations and a number of difficult to control co-founders in these studies. So despite these findings, most studies are cross-sectional, not designed to prove cause and effect. Other factors like smoking, age, diabetes also influence both obesity and gum disease, so it's hard to isolate obesity as the sole cause of periodontitis. The summary is that there is a modest but consistent link between obesity and periodontitis. Chronic inflammation, immune dysfunction, and adipokines actively likely to play a key role in the progression of periodontitis. While more prospective studies are needed, the current evidence suggests that maintaining a healthy weight may also help to protect your gum health. So it is just about time to tell your patients about the association about obesity or their overweight, and how that can have an influence on their gum disease and the results that you can get from your non-surgical therapy. Oh, hello there! If you want to know more about evidence-based insights in periodontics, don't forget to subscribe to our channel, Healthy Gums Dentist or Keystone Periodontics, on Instagram, YouTube, or on Facebook page.